Hi, Steve.
Hi, Sue.
All right. So again, I've had some more questions from the domiciliary care sector. They
Okay.
want to know, well, how will this benefit them? They're going out, their staff going out to see people that they're well trained. Most of them have got their level 3 qualification. So why would they need to do this?
Well, as you know, I'm currently a registered manager for a domiciliary care service, and I've run this course as the clinical lead to my service, and I've had 10 members of my senior team train up as level 5 assistant practitioners. And the benefits for me as the registered manager is the fact that I don't have to go out anymore. As my carers are going out, especially during the pandemic, they've been able to do the assessments, they've been able to monitor physical health. When we've had situations where, and I'm sure other domiciliary care managers have had the same, where maybe the district nursing team haven't gone out to be able to see the customers, we've pretty much picked up all that slack. So we've been doing things such as catheter changes, we've been doing glucose, we've been doing insulin, we've been doing wound care, because people just haven't been able to get out. The NHS was completely stretched. So it's been an absolute lifeline for our service to be able to teach this program, because it means that my team have done some training with me as a registered nurse. I've upskilled them, signed them off on their competencies, and then just got them out in the community practicing those skills and using them. And it just means that as the manager, I've now really pushed the standards of home care up. So we've got a lot of nursing customers and a lot of customers that should be moving into services, but they can't move into services because of COVID or other restrictions. So we've been able to really provide nursing home care in people's homes. And it's okay, people say, but that's not what we do in domiciliary. But if you're the registered manager and you've taken a commitment to look after somebody, it's your responsibility to make sure that that person is safe. It falls under your duty of care. So for us, it's been an absolute lifeline and godsend to have assistant practitioners that I've been able to go, can you go out and do the assessments? Can you go out and do the reviews? Can you go out and change that wound? That catheter's blocked. Can you change, can you clear that now and flush it? Because if you don't, it's going to cause further infections and further complications. That wound needs changing, or the pads come off because maybe the customer's been incontinent or doubly incontinent and the pads rolled off the back, the pressure sores are showing. Just having them there, because they're already there, the carers are already in these people's homes. Doesn't it just make sense that our workforce can deal with those and not walk away and feel that we've left people in a position where they're more vulnerable? So from a home care point, it was inevitable eventually that we were going to have to upskill our workforce to manage some of these new skills. And equally, I'm sure in a lot of domiciliary services, you have that turnaround of staff. So people are leaving because they want job security, they want fixed hours, or they want to upskill and they want to go into further courses. So by offering this course, you're able to do retention to up to 18 months to keep that member of staff. You're giving them an opportunity to progress, and you're giving them a purpose, so it's quite motivating for the staff. So we've seen a real increase in job satisfaction as well. And then from a CQC and a contracts point, well, from a CQC point, we're able to demonstrate really safe, effective and responsive care because we're doing it. And then from a contracts point, we've secured our contract and growth in our contract. So we went from 400 hours to 2,500 hours using this model, because it means that the council now trust us as a service to provide an exceptional level of care. And when you've got new carers going out and they're having to shadow, you pair them up with one of your level 5s. And arguably you could say, but Steve, we have that as a care coordinator. The problem is care coordinators are not nurses or assistant practitioners. They're level 3 trained people with on the job experience. So they're still not allowed to do things like give insulin or change a wound dressing. Wouldn't it be nice for them to have that skill set to be able to do that? Because they would feel far more useful for the customer as well. So there's a huge heap of benefits for a domiciliary care service to upskill some of their workforce through this level 5 qualification.
But can I just ask? We only have private customers. We don't have any council contracts. So
Yeah.
why would it help us?
So again, if you're lucky enough to have just private only customers, you're looking at being unique in the industry. So it becomes a selling point, doesn't it? Our staff are highly trained. So when we use that term, we're saying that they're degree equivalent trained in healthcare. So if I was to, if I'm paying for my own care, if I've got my own direct payments, or I'm a private customer, who would I pick? Would I pick the organization that has, good carers, or do I pick the organization that's got highly skilled, people that are trained to foundation degree levels in health? Because you would have far more trust in that organization, wouldn't you, to pick up early signs of deterioration, to know what to do in an emergency, to be able to change a dressing, to be able to clear a catheter, to be able to give insulin if needed, to be able to recognize mental health conditions and psychosis and all those other things. So this qualification just opens up a world of knowledge to the caring industry. And then from a trust point of view, who would you trust? You're going to trust the one with that qualification, aren't you? So for me, it was a no-brainer decision. And a year down the line, I'm really seeing the benefits, because now, as the registered manager, I'm not stressing, I'm not worried. I know I've got an effective team around me who are responsible and are able to do the job, and do the job to the same standard in which I would be doing it, because that's what the level 5 does. It upskills them to that level of thinking.
Okay, thank you. That's really interesting. That's, again, I found that fascinating. Thank you.
No worries. Thank you too.